The Devotion Network is a large team grant that's housed within the Children's Hospital Research Institute of Manitoba. It's comprised of 4 big research pillars that span from basic science, working with animals and cells, all the way to policy, where we're changing practices and the way the province runs to improve child health in the earliest years.
Devotion as a network is important because it brings Manitoba experts together and in a way that enables research discovery to be translated into policy and practice more efficiently.
One of the unique aspects of our Devotion Network is that in addition to the 4 pillars that we have, we work really closely with stakeholders who are disproportionately affected by some of the chronic diseases affecting children, like diabetes, obesity, asthma, and allergy. In particular in Manitoba, those are our First Nations partners or Indigenous partners. What I'm particularly interested in is the impact of being exposed to gestational diabetes on the long-term cardiovascular risk for young adults and adolescents in our province.
My research is really honing in on trying to understand what is it that happens when baby's in womb or just after birth that really is the cause of elevated risk for asthma.
There are so many things that happen early in life that can program us for chronic disease risk, that if we can alter those behaviors and alter some of those things early in life, that we can set the course for a healthy life for generations to come.
The fact that devotion is tied directly to CRIM really is vital as a mechanism for the research discoveries to make a difference.